Hi viewers, drug overdoses are always scary and tragic events, with many of them leading to fatalities. In fact, since 2000, more than 500,000 Americans have died of an overdose. An overdose is a biological response to when the human body receives too much of a substance or mix of substances. People can overdose on illicit drugs, alcohol, prescription medications, and many other substances. Most individuals who have overdosed can be saved if medical treatment is provided quickly enough, but it can cause permanent organ damage as well. In today's video, we'll tell you what happens to your body when you overdose, from causing abnormal breathing, dilated pupils, confusion, seizures, to permanent brain damage, and more. Watch until the end to find out all of them. Number 1. Drug spreads throughout your body. When you take an opioid, whether a pill or an injectable, the drug enters your body and travels through your synapses, through the heart and into your lungs. This is where the blood gets flushed with oxygen before getting drawn back into the heart once again. With the next pump of your heart, your now opioid-rich blood is pushed out to the rest of your body, where it plugs into the system of opioid receptors all over the body. Number 2. You get happy. Once the opioid molecules are ferried across the blood-brain barrier, they enter the section of the brain which is the center of your reward circuitry. This is called the nucleus accumbens, where the happiness hormone dopamine is produced. There, the drug latches onto GABAergic neurons. Imagine GABA as a dam. They make sure your dopamine doesn't overflow, which can cause agitation and paranoia. Opioid molecules blow that dam open and let dopamine spill over into the bloodstream, creating a feeling of bliss way beyond what the GABA cells would normally allow you to experience. Soon the high evens out, and even before the rush is over, you might start to nod off, head dipping and jerking as you drift between waking and asleep. Enjoying the list so far? Well, keep watching, because there's a lot more good stuff coming up. But before moving on, don't forget to subscribe to our channel for more amazing videos like this, and hit the bell icon so you don't miss any updates. Number 3. Dilated or pinpoint pupils. Depending on which type of substance used, pupils can change in size and show a rapid quivering effect called nystagmus. When using narcotics, including heroin, morphine, hydrocodone, and fentanyl, a person's pupils will constrict, while other drugs such as cocaine makes pupils dilate and become larger. Number 4. Abnormal breathing. When your body is in a state of emergency or the air passages become blocked, it will often exhibit slow, difficult breathing combined with rapid breathing or gasping for air. This is an attempt to regulate airflow. Number 5. Blue lips or fingertips and body. Some people experience a rise in bodily temperature during an overuse of substances, though it is common to see a body change in color as their body temperature will drop, turning lips and extremities to a bluish color. This is a direct sign of a lack of oxygen in the body and means the person is close to expiring. Number 6. Nausea and vomiting. Often a person will aspirate during an overdose, causing the body to respond by vomiting its contents out of the system. If the person is unconscious and vomits, unable to expel it from their mouth and windpipe, they may end up choking on it. Number 7. Chest pain and irregular heart rate. Too many stimulants can lead to rapid heart rate and lead to heart pain and cardiac arrest. An overly stressed heart can cause small muscle tears, resulting in bleeding and severe pain. Opioids tend to have the opposite effect, causing slower breathing and reduced heart rate. Number 8. Confusion and disorientation. Confusion and disorientation accompanied by severe anxiety can also exhibit signs that a person is overdosing. When people are conscious, they may not be aware of their surroundings or be able to physically keep their balance. They can talk rapidly or nonsensically, lash out verbally and physically, stumble, fall, cry, or scream. Sometimes a person will exhibit violent and aggressive actions prior to losing all function. Number 9. Foaming at the mouth or choking. You foam at the mouth or choke. Sometimes opioid overdose can include pulmonary edema, which is a fluid leak into the air spaces of the lung. This is not caused by fluid backup from a failing heart. Doctors are still unsure of the exact mechanism behind this event. This manifests as foam coming out of your mouth. It is not uncommon for opioid overdose patients to experience aspiration. This is when your body's natural gag response is suppressed or eliminated by the opioid's effects on the respiratory control center of the brain. As you become increasingly less conscious, the natural secretions in the back of the throat are not ejected or swallowed. Opioid patients who vomit can also aspirate their vomit and die. Number 10. Unconsciousness. When the brain cells receive an overwhelming amount of toxins, they can shut down. The severe pressure on the brain caused by substance abuse or a combination of substances can cause a loss of consciousness. Number 11. Seizures and trembling. When the brain is stopped from performing normal activity and becomes disrupted, electrical activity is deregulated and can cause cells to malfunction, throwing the body into convulsions or seizures. Overuse of toxic substances is one of the reasons why the brain has abnormal electricity. Seizures can permanently damage brain cells, and some people may not survive them. Shivering and trembling may be signs of the early stages of an overdose and can lead to a more serious seizure. Okay, moving on. Here are some of the long-term implications of overdosing. Number 12, serious injury. In addition to the potential fatality, the effects of overdose can include serious injury. For example, sometimes overdose can cause nerve damage, permanent injury, or even paralysis of the limbs. This can occur when someone overdoses and remains in the same spot or position for a long time before they're found. Certain positions, such as bent leg or arm, can cause blood circulation to be cut off from the limbs. This can lead to nerve damage, long-term pain, a limp, or decreased mobility, or can even cause someone to require amputation of a dead limb or paralysis. Number 13, loss of body parts. There's another thing that's common for people who overdosed and have been in the same position for a while. When blood circulation is cut off and a muscle dies, it's known as compartment syndrome. Treating it can lead to a loss of parts of the body or disfigurement, also known as NPR. More often than not, the effects of the disorder are acute or non-permanent, but there are cases in which individuals lose function or mobility of limbs due to this syndrome. Number 14, brain damage. When someone overdoses, sometimes their brain is deprived of oxygen for long periods of time. This is due to the cease in breathing. Without oxygen, your brain cannot work as it should. This can cause permanent brain damage, loss of vision, hearing, or even a vegetative state in which a patient is only kept alive by machines. This is called toxic brain injury. Unfortunately, almost 25% of patients who seek treatment for a brain injury have experienced their trauma during drug use or overdose. Number 15, kidney damage. Along with the brain, the effects of overdose can also include damage to other organs of the body. The cutoff of blood flow is caused by being stuck in one position for a long period of time. This happens when people overdose and are unable to move. As I mentioned earlier, this can also prevent the body from filtering toxins out of the blood. As the muscles and tissues begin to break down, the chemicals they produce can also build up. This can cause the kidneys to shut down, and damage can be permanent. This can result in diminished kidney function or the need for long-term dialysis. What to do during an overdose? An overdose can occur anytime a person is abusing drugs or taking more of a prescribed drug than what a doctor recommended. In regard to this potential situation, here's how you can help. Number 1, do not leave the overdosing person alone unless you have no alternative because you have to call an ambulance or get help. Number 2, try to get them to respond to their name and simple questions. If you know first aid such as CPR and it is warranted per your training, act accordingly. Number 3, monitor the person's consciousness. Create an environment that is comfortable, such as trying to cool down an overheated stimulant overdose victim. Number 4, calling an ambulance may seem like a judgment call, but it's better to be safe in these situations and get professional medical help to the scene as soon as possible. Number 5, call 911 immediately if a person has a seizure, severe headache, chest pain, or trouble breathing. Number 6, there are cases of overdose where people involved think that the overdosed person is fine because he begins to snore. This activity may be deemed sleeping it off, but that interpretation can be dead wrong. It's critical not to ignore snoring, even if the person is a known snorer or gurgling. Snoring can be an indication of breathing trouble, and any obstruction of the breathing airways can be fatal. In the case of a substance abuser snoring, wake the person up immediately and seek medical attention if needed. Has anyone you know ever overdosed? What did they overdose on? Let us know in the comments below. Enjoyed this video? Hit like, share, and subscribe to Curiosity. Wait! Why not fulfill your curiosity by watching these other awesome videos? Go ahead, choose the left or the right video and enjoy.